Right. I am Dr. Aves. Today we will discuss another case of pulmonology. And today we will discuss a very important case in pediatrics. So, can you spot abnormality in this X-ray? I give you 5 seconds. Yes. So, this is an X-ray of a newborn who was born at full term, and the baby was delivered through C-section. And on examination, he was having a tachypnea and nasal flaring, intercostal section, and clear breath sound. No, and he was not having any fever. So can you guess diagnosis now? And I want to give you another clue. There is very important finding on this X-ray. You can see. If you can see finding on this X-ray with the background of that clinical history, you can easily diagnose this patient, right? So yes, this is a case of transient tachypnea of newborn, right? So how you will come to know? When we did his chest X-ray, we found this. This is very important clue in a patient who is full term and has had a C-section and is having a difficulty in breathing. This is very important clue, and this is fluid, right? This is fluid in the interlobular fissure. I am encircling with my pointer, right? This line, this is I am circling with my black pointer. This is very important finding. This is important finding to diagnose transient tachypnea of newborn. So whenever a patient comes to you who was delivered through C-section and baby was term and is having a tachypnea shortly after birth, nasal flaring and retraction, intercostal retraction and nasal flaring, you should suspect. And there is also important clue that I mentioned over here, a fluid in the interlobular fissure. You should suspect that the patient is having a transient tachypnea of newborn, and it is common in term babies and those babies who has been delivered through C-section, because normally when the mother is under labor, there is catecholamine secretion, right? That help in the resorption of the fluid in the alveoli. But when there is C-section, there is no catecholamine secretion, and that result and the fluid that is unable to reabsorb. That fluid shows in the interstitial lobular, and that result in the transient tachypnea of the newborn. So this was a classic case of transient tachypnea of newborn, and this was a classic chest X-ray of transient tachypnea of newborn.